The calls and text messages are relentless. On the other end are doctors and scientists at the top levels of the NIH, FDA, and CDC. They are variously frustrated, exasperated, and alarmed about the direction of the agencies to which they have devoted their careers. Quote, "It's like a horror movie I'm being forced to watch and I can't close my eyes. People are getting bad advice and we can't say anything," lamented one senior FDA official. That particular FDA doctor was referring to two recent developments inside the agency. First, how, with no solid clinical data, since the data is being collected, as we speak, the agency authorized COVID for infants and toddlers, including those who already had COVID. And second, the fact that just months before, the FDA bypassed their external experts to authorize booster Ts for young children. That doctor is hardly alone. Welcome, I hope that you are well. According to some U.S. officials, the U.S. public health agencies they work for aren't, quote, following the science. People are getting bad advice and we can't say anything, end quote. At the NIH, the U.S. National Institute of Health, doctors and scientists are complaining of low morale and lower staffing. The NIH Vaccine Research Center has had many of its senior scientists leave over the last year, including the director, deputy director, and chief medical officer. Quote, "They have no leadership right now. Suddenly there's an enormous number of jobs opening up at the highest level positions," according to one NIH scientist. The people who spoke to Common Sense reporters would only agree to be quoted anonymously. These scientists are said to have cited the fear of professional repercussions. The CDC has experienced a similar exodus. The Centers for Disease Control and Prevention, CDC, is the national public health agency of the United States. Quote, "There's been a large amount of turnover. Morale is low," said a high-level official at the CDC. "Things have become so political, so what are we there for?" Another CDC scientist reportedly said, quote, "I used to be proud to tell people I work at the CDC. Now I'm embarrassed," end quote. So why are they embarrassed? In short, bad science. The longer answer is that the heads of their agencies are using weak or flawed data to make critically important public health decisions. That such decisions appear to be driven by politics. And that they have a myopic focus on one virus instead of overall health of the people. Nowhere has this problem been clearer or the stakes higher than on official public health policy regarding children and COVID. First, they demanded that young children be masked in schools. On this score, the agencies were wrong. Compelling studies later found schools that masked children had no different rates of transmission. And for social and linguistic development, children need to see the faces of others. Next came school closures. The agencies were wrong, and catastrophically so. Poor and minority children suffered learning loss with an 11-point drop in math scores alone and a 20% drop in math pass rates. There are dozens of statistics of this kind. Then they ignored natural immunity. Wrong again. The vast majority of children have already had COVID, but this has made no difference in the blanket mandates for childhood Ts. And now, by mandating jabs and boosters for young healthy people, with no strong supporting data, these agencies are only further eroding public trust. One CDC scientist Common Sense reporters about her shame and frustration about what happened to American children during the pandemic, quote, "The CDC failed to balance the risks of COVID with other risks that come from closing schools, learning loss, mental health exacerbations were obvious early on and those worsened as the guidance insisted on keeping schools virtual. CDC guidance worsened racial equity for generations to come. It failed this generation of children," end quote. An official at the FDA put it this way, quote, I can't tell you how many people at the FDA have told me, I don't like any of this, but I just need to make it to my retirement, end quote. What do you think about this report? When those that work in the institutions tasked with protecting public health are suffering from having low work morale, when they are quitting, when those who are staying on at these health establishments are just hanging on for the sake of their pensions. What is your opinion of this matter? This catastrophic state of affairs will reverberate for a long time to come. What a time to be alive. The whole report is available both on the Defender, childrenshealthdefense.org website and in the Common Sense Journal. If you like practical tips to better wellness, including health information, please visit my website at www.wellnessgal.com. Again, thanks for listening. Till next time. Be well and stay well. May we all get the wisdom and strength to overcome the challenges of this age.